Eyelid surgery, also known as blepharoplasty, is commonly used where people are requesting surgery to improve the appearance of either the upper or lower eyelids or both. The most common presenting feature of upper eyelid surgery is where people are requesting surgery to remove a fold of skin which is developing, which they see is obscuring or obliterating the natural fold of the upper eyelid. And that can be done on its own under local anesthetic, and it's very satisfactory in achieving a nice contour of the upper eyelid. Lower eyelid surgery is commonly requested by people who present with what they see as tiredness and puffiness of the lower eyelids, especially at the end of the day, and are looking for procedures to rejuvenate or to give them more youthful looking eyes. And certainly, in my opinion, eyes are the most important feature of the face because they really do demonstrate an aging feature if it's not addressed properly. So lower eyelid surgery is done with a scar which can either be within the eye itself, so there's no scarring at all visible, and that is aimed at reducing the fat component of the lower eyelid, more commonly used clearly in the younger patient. In people who've got a lot of loose skin, the skin needs to be addressed as well, and that would involve scarring along the margin of the lower eyelid and slightly outwards into the crow's feet, so it can be hidden, certainly with makeup in the female, be virtually invisible. Surgery for blepharoplasty, if one looks at the upper eyelids, these are classically done under local anesthetic, and a small dental syringe and needle are used just to infiltrate the local anesthetic along the margins of the upper eyelid, and an estimated amount of extra skin is removed from the upper eyelid, leaving a scar which extends from one part of the upper eyelid to the other. So if you like, a little envelope of skin is removed, and if there is any fat deep to the eyelid which is causing any puffiness, that is then removed as well, and the scar is sutured. The scar is virtually invisible on forward gaze and will only be noticeable by someone who is looking at you directly with your eyes closed. Regarding the lower eyelids, this can be done under local anesthetic as well, but traditionally, if both uppers and lowers are being done at the same time, we would tend to use general anesthetic, and scarring is made just along the inside of the lower eyelid, just beneath the eyelashes, and extends into the crow's feet. The fat element of the puffiness, which is what patients want removed, is identified and removed. And if necessary, if there's any looseness of eyelids, the eyelid tension, that needs to be tightened at the same time to give good symmetry, because one of the biggest problems following surgery is asymmetry of the lower eyelids. Clearly, two eyes are naturally asymmetrical, but following surgery, patients would expect them to look as symmetrical as possible. Recovery from eyelid surgery is very rapid indeed. It's probably the one procedure where stitches are removed at only 4 days after surgery. And this is mainly because one wants to minimize the risk of any stitch marks, and also the wounds heal extremely rapidly, with the risk of infection being virtually nil in this area. There obviously is the potential for some degree of bruising, and all bruising takes on average 10 days to settle. So I would say there is some swelling which occurs within the first 24 to 48 hours after surgery, but that inevitably, as quickly as it comes up, will also disappear. I would say most people should be looking at about a week off work after a blepharoplasty. There are risks associated with blepharoplasty which can be divided into the early and the late risks. The early risks are those associated with the procedure itself, such as bleeding, and very, very rarely blindness has been associated with the blepharoplasty, but this is less than 1 in 1,000, and it's something which is incredibly rare and more often associated with conditions which are pre-existing, such as glaucoma. So it is important that patients make us aware of any potential history of eye-related problems. The long-term risks of a blepharoplasty, they clearly the potential for slight asymmetry with one scar being slightly different in length to the other one is potentially an issue. But if one recognizes that no two halves of the face are identical, and it may be necessary to make one scar longer than the other to get rid of any loose tissue, that usually is acceptable.